In celiac disease, a protein in wheat, barley, and rye called gluten triggers destruction of tiny hair-like protrusions called villi in the small intestine. Normally, villi allow vitamins, minerals, and other nutrients to be absorbed through the wall of the small intestine into the bloodstream. In celiac disease, gluten triggers the immune system to damage or destroy the villi. Instead of being absorbed, fats, proteins, minerals, and vitamins are eliminated in the stool. Decreased absorption of nutrients, or malabsorption, can cause malnutrition and other long-term problems. Is the number one disease you've never heard of making you sick? Celiac disease affects 3 million Americans, yet 95% don't know they have it. Common symptoms include diarrhea, fatigue, migraines, infertility, skin rashes, depression, chronic stomach aches, anemia, slow growth in childhood, joint and bone pain. Celiac, a total intolerance to gluten, the protein in wheat, rye, and barley, can strike anyone at any age, your friends, family, co-workers, and if left untreated, it can lead to rheumatoid arthritis, diabetes, osteoporosis, cancer, and more. The good news, celiac is controlled by a gluten-free diet. Diagnosis starts with a simple blood test. 1 in 133 Americans suffer from celiac disease. Are you the one? If you or a loved one suffers from these symptoms, contact the Celiac Disease Foundation at celiac.org. Early diagnosis will be life-changing.
Celiac disease is an allergy to gluten, which is found in processed foods such as bread products and pastas. A lot of times it gets overshadowed by other allergies that kids may have, such as peanut allergies and dairy product allergies. About 1 in 250 children are diagnosed with celiac disease. A good way to find out if you're at risk for celiac disease is to look at your family history, since it is primarily a genetic disorder. One of the most common symptoms, especially in kids, is irritability. Kids are irritable anyway, so you have to look for other symptoms such as nausea, vomiting, a bloated belly, muscle wasting, fatigue, and just failure to thrive in general. It's a simple blood test to determine whether or not you have celiac disease. And unfortunately, once you have it, it's not something you can get rid of. But it is 100% treatable. As long as you stick with a gluten-free diet, then you'll be fine. No more symptoms.
What foods should someone with celiac disease add to their diet? What foods should someone with celiac disease avoid?
Celiac disease is a condition where the lining of the small intestine is damaged due to an allergic reaction to gluten. People with celiac disease should incorporate plenty of fresh vegetables, fresh fruits, rice, nuts and seeds, low-fat milk products, and lean meats into their daily intake to ensure a well-balanced, gluten-free diet.
So now let's talk about a gluten-free diet. But first, what is gluten? Gluten is a protein found in wheat, rye, and barley. So these are the 3 major grains that patients with celiac disease need to avoid. We often advise patients with celiac disease to stop eating oats also, especially early during the treatment. Oat does not contain gluten, however, it can be contaminated by gluten-containing product during the processing. Gluten can hide in many prepared foods such as ketchup, mustard, ice cream, french fry, canned soup, etc. So this is why you need a skilled dietitian to teach you how to read the labels and find which prepared food contains gluten. Despite all these restrictions, patients with celiac disease can have a healthy and varied diet. Meat, dairy product, vegetables, and fruits are naturally gluten-free. There are also other grains that are safe to be taken by people with celiac disease and other alternatives to flour. For a list of safe grains and alternatives to flour, talk to your dietitian and she will help you find gluten-free products. You can also get good information from celiaccentral.org. They have a good list about safe and gluten-free food that you can have.